Hey everyone, welcome back to another episode of Doctors Go Live. I am Nina Sharil Khan, your host today for Doctors Go Live. And today we're going to be talking about breast cancer, debunking the myths and misconceptions, because after all, it is Pink October month. Okay, so let us know if you're tuning in, where you're tuning in from, and share with us what would you like to learn from today's episode of breast cancer, debunking the myths and misconceptions. Now, if you share this video out, we've got a special treat for you. You get to take part in our Doctors Go Live quiz happening right here at the end, right after the question and answer, where you get to win a foldable travel bag. All right, Jasmine, welcome. So nice to see you tuning in. Now, all this is happening right here on Doctors Go Live with me, Nina, and our very special guest for today, Dr. Kiran Kaur. Now, ladies and gentlemen, breast cancer or any cancer for that matter, it's not talked about often. And when it is talked about, it's not always based on facts. So, how can we tell the difference between fact and fiction? And what are the myths and misconceptions surrounding this disease? So, to help you arm yourself with the right facts, we're going to look into all this and so much more happening right here on Doctors Go Live. Okay, so if you know somebody who suffers from breast cancer, or people who are taking care of people suffering from this disease, or if you think this is such an important topic and it's going to make a difference to somebody out there, please do share this video out, because it can make a difference to somebody out there. All right. So share it out on your social media, tag your friends, follow us on social media, because this episode is definitely going to make a difference in their lives today. Okay. So before that, let's take a look at this video.
Hello everyone, it's Pink October and everyone's talking about breast cancer. But what are they talking about? Myths or facts? Well, there are a lot of misconception and misinformation out there in the general public regarding breast cancer. So let's arm ourselves with the correct information regarding this disease. I'm Dr. Kiran from Columbia Asia Hospital, Klang. I'm a general surgeon with special interest in breast surgery. Join us live on Doctors Go Live on the 27th of October 2021 at 3 p.m. Let's discuss this interesting topic together. See you soon.
Welcome back, ladies and gentlemen. Welcome back, Jasmine Liu, Ida Nazri, Xiao JC. Thank you so much for tuning in, and so many of you guys tuning in, because as Jasmine said, this is definitely an important topic, not just for women, but for men as well. Yeah. So welcome back to Doctors Go Live, and today we're talking about breast cancer, debunking the myths and misconceptions. Now, when it comes to cancer, there's a lot of misinformation and misconceptions surrounding this disease. In fact, it's this misinformation that can prevent you from recognizing and minimizing the risk of breast cancer very early on and getting the best possible care. So to help us separate fact from fiction when it comes to breast cancer, we've got you our resident expert from Columbia Asia Hospital, Klang, Consultant General Surgeon, Dr. Kiran Kaur. Dr. Kiran, thank you for joining us.
Hi everyone. Thanks for inviting me. Thanks to everyone for making your time to join us this evening. Hope we'll have an interesting discussion today.
Fantastic. I think people are ready to get go, because right from the start, they're already asking questions. Yeah. Okay. So first things first, Dr. Kiran, could you share with us a little bit about yourself and what is it that you do?
Okay. As you already know, I'm Dr. Kiran. I'm actually a general surgeon with a special interest in breast surgery, and I'm currently practicing at Columbia Asia Hospital, Klang. Um, I've been trained as a general surgeon, and I was attached to University Malaya Medical Center for breast training for a year plus, and hence I have a special interest in breast surgery. So I do practice general surgery. I do various other surgeries, but I do many breast surgeries as well.
Wow. Okay. You're definitely the expert to talk to about this as well. And not just you, we've got Dr. Jamali Wagiman. from Colombia, Saramban tuning in, and Momo Bubu has also shared. Jasmine Liu has shared. So very interesting topic today. So many people are on board. So let's get straight into this then. How common is breast cancer, Dr. Kiran, if you can share with us?
Okay. Okay. When we speak about breast cancer, we should be aware that it's the most common cancer that is diagnosed both, I mean, in the world as well as in Malaysia. It's the most common cancer that is diagnosed worldwide. In Malaysia, in a span of 5 years from 2012 to 2016, almost 22,000 new cases of breast cancer was diagnosed. This is the Malaysian statistics. What about the global statistics? Based on GlobalCan, our global cancer network, the data showed that there were 2.3 million new breast cancer cases diagnosed in 2020 alone, and that's a huge number. Well, even in Malaysia, we are seeing the same trend. It is the most common cancer that is diagnosed in our country, and over the years, the incidence is increasing, the mortality is increasing as well.
Wow. So in terms of trend, it's increasing, yeah?
Yes.
Okay. Well, when we talk about the stage of the disease, are Malaysian women generally diagnosed very early on or at a later stage?
Actually, this is the sad thing about what's happening in Malaysia. Most you see, if we look at this pie chart that I've shown here, almost 50% of our patients, which is almost half of our newly diagnosed breast cancer patients, are diagnosed at a late stage or at one stage, stage 3 and stage 4. Our hope is that we give many talks, discussions, public awareness campaigns. Our hope is so that we diagnose patients at an earlier stage, stage 1 or stage 2, rather than stage 3 and stage 4. Why? Because when we detect patients at an earlier stage with prompt treatment, outcomes are definitely better. Mortality is, definitely improved, as well as we don't have to deal with all the morbidities that come along with an advanced disease. Yeah, so this is the state in our country. Almost half of our newly diagnosed breast cancer cases present at a late stage.
Okay, got it. I have to ask you something. Why is this happening? Why are so many cases kind of diagnosed at a later stage? What's happening? And what should people know?
That's a very valid question. I suppose many patients, firstly, could be in denial that they know something is wrong, but they can't accept, they don't come forward to seek help. Or another group of patients that we commonly see is that lack of education and knowledge about the symptoms. So you see, like I was like I had a patient which I diagnosed with breast cancer a few weeks ago. She was only 23 years old. She had a 8 centimeter lump in her breast with some eroded nipple, and the areola complex was already ulcerated. But she thought it was normal. It's not something dangerous. So it all boils down to knowledge and education about symptoms, and when to seek help and when to come forward for a treatment. So when patients come late, they are already at stage 3, stage 4, which is, it definitely will affect the outcome.
Wow. Okay, so basically it's kind of not knowing that they have it, or not being very sensitive to the changes of the body, yeah? Kind of
Yes.
thing, I would say. Okay, got it. So very important, yeah, guys, and that's why everybody's here tuning in, because it could happen to your sister or a friend. You never know. It's important to be aware and to kind of share this awareness out there, yeah? So let's talk about we're living in Malaysia. It's a multiracial country. Is the incidence the same for all race, or is it slightly different?
It's definitely different. This data actually I extracted from our Malaysian Cancer Registry. It shows that in our country the incidence is highest among the Chinese. 1 in 22 Chinese women in their lifetime will be diagnosed with breast cancer, followed by the Indians, 1 in 23, and then the Malays, 1 in 30. Yeah, this is the scenario in Malaysia.
Any idea why that is so? Just wondering.
Well, there was a study done showing that Chinese patients tend to have denser breasts compared to the other races. That could be a possibility why it is commoner in Chinese compared to the other races. Dense breast is a known risk factor for breast cancer.
Wow. Okay.
Yeah. There
So
could be
that's
other reasons as well, but this is what some studies have shown. Yeah.
hmm. Just to share some of the comments that people are sharing, Jasmine is saying, wow, the data shows cases for that 291 cases for male. And of course, Ida is also sharing male 1.34. I think that's what people are finding very surprising. Um, wow. Okay. We'll go into the questions in a bit. Yeah, Jasmine, but hang in there. In the meantime, if you guys have questions, just type it in and we'll be able to answer it right at the end. Yeah. Okay, let's go straight into today's topic, the myth and misconceptions surrounding breast cancer. So let's discuss some of this, the most commonly heard ones. Is it true that only older women will get the disease, Dr. Karen?
Definitely not true. Like I mentioned earlier, I recently diagnosed a lady who was only 23 years old with huge breast cancer, right? 8 centimeter lump in her left breast. You see, why she came late was because first thing, she was not aware about the symptoms. Secondly, she thought she was young. She was young, so if you are young, you shouldn't be getting such a disease. It's only meant. I mean, breast cancer usually affects only the older woman. So of course, she delayed coming forward to seek help. But you see, this is not true. We need to change this concept.
Belief. Uh-huh.
That breast cancer can also affect the younger age group. If we look at our Malaysian data, the incidence of breast cancer starts increasing when you're 25 years and above. And if we look at this graph, it steadily increases and it peaks at about 60 to 64 years. And following that, it starts decreasing. So you can get breast cancer at any age. It's just that as you get older, your risk increases further. But it does not mean that if you're young, you cannot get breast cancer. Yeah.
Wow. Okay, got it. So remember, guys, it strikes at any age. It doesn't mean that you got to be old in order to get breast cancer. It affects young women as well. Yeah. Okay. What about a lot of people are saying that it's inherited? How are all breast cancer cases inherited?
No, of course not. Um, you see, when we diagnose patients with breast cancer, majority of them have no family history at all of breast cancer, and they are shocked. Why, doctor? How can I get this disease? I don't have anyone in my family with breast cancer or any other cancer for that matter. But you see, only a very small percentage of patients have significant family history of cancer, and majority of the cases are actually sporadic. So if you do not have any family history of breast cancer, it does not mean you will not get the disease. So you still should come forward for your screening mammograms. If there are any abnormalities, you still should come for evaluation of your breast. It doesn't mean that if you have a lump but you don't have any family history, you don't have to do anything about it. It's not true. Yeah.
Right. Okay. This is very shocking for me because I would have thought the number was higher, but it's only 5 to 10% are inherited. So that means 90% of breast cancer cases are people who've never had.
Already.
Yeah, that sort of thing. Really interesting to see the numbers. Okay. Let's talk about, since we're talking about lumps, how do breast cancer patients usually present? Is it from the lumps alone?
Actually, breast cancer can present in, many, many ways. We have one third of patients who do not have any symptoms at all. So they are picked up by screening mammograms, or those who come for medical checkups, and they are diagnosed with cancer in their breast. But those who are symptomatic, meaning those who have symptoms, we get about 60-70% of our breast cancer patients coming in with symptoms. Not all patients present with lumps. Lump is just one of the symptoms that they could be having. There are so many other symptoms that patients tend to present with, and they're having breast cancer. So not all patients with breast cancer um, not all patients with breast cancer will present with lumps. And the other way around, not every lump is cancerous. Yes.
Right. Okay. So the important thing is if you have a lump, go have it checked. And even if you don't
Exactly.
have a lump, it doesn't mean you do not have breast cancer. Yeah.
Yeah. If you
Okay.
have a lump, just come for evaluation. If it's not cancer, it's good. At least get it checked. If it's cancerous, at least you detect it early, right? Yeah.
Mm-hmm.
Don't just keep it thinking that it's probably something benign, especially if you are young. You can't be having cancer, so just get it checked. It's
Right.
safer that way. Yeah.
Okay, Doc, since we're talking about getting it checked early, just wondering, in the cases of when we detect it early, what's the rate of recovery compared to when we discover it at a later stage? So that people tuning in can understand the importance of, checking it early.
Okay, when we speak about outcomes, we speak about 5-year survival rates in
Okay.
cancer. So when patients are diagnosed at stage 1, stage 2, their 5-year survival rate is very high. For example, stage 1, 5-year survival rate can go up to 95%, meaning that at the end of 5 years, 95% of these patients are still alive. But when the disease progresses to stage 3, stage 4, 5 years survival drops significantly. Yeah. So not many are still alive after 5 years.
Wow, that's quite a stark contrast, actually. 95%, and you said not many are still alive after 5 years?
Yeah, that's why we keep stressing so much on early detection, screening programs, because early detection saves lives, right?
Definitely. Okay, let's take a look at the next slide. Like, how does breast cancer patients usually present if it's not just lumps?
Okay, I think this is a very, very important slide to create awareness and some knowledge about other symptoms that patients can have. So, any of these symptoms, if you have, please come forward to seek help and evaluation of your breast. So, the first thing you would look out for is breast asymmetry, meaning that both the breasts do not look symmetrical, do not look the same, one bigger than the other. There could be a lump in the bigger breast. And then we look at the skin changes, such as dimpling of the skin. There could be a tumor beneath the skin, pulling the skin downwards or inwards, causing a dimpling on the skin surface. Any recent changes to the nipple, meaning that if the nipple is protruding all this while and suddenly it's flattening or getting inverted, there could be something going on behind the nipple areola complex. And other symptoms will be abnormal nipple discharge. Any brownish discharge or blood coming out from your nipple is not normal. Please get it checked. Any excoriation or rashes around the nipple areola complex. Any lumps, which we discussed earlier. Any ulcerated skin changes, as well as redness of the skin. All this is not normal. Please come and get yourselves checked. You see, skin redness could be a sign of infection as well, any inflammation, any inflammatory process going on in the breast, yes, and that is not cancerous, but still get yourself checked and make sure nothing dangerous is going on. Yeah.
Wow. Okay, so there's all these other symptoms to look out for. These cases that you're talking about, is this like third, fourth stage, or it could be one and two as well? The ones that you're sharing right now.
Oh, these are all various stages.
Okay, got it. So you can tell if it's stage one, two. The important thing
No,
is get it checked early.
yes, stage will depend not only on the lump, it will depend on your lymph node in your armpit, the status of the lymph node in your armpit, as well as if it has spread elsewhere. So staging of breast cancer is not about only looking at the breast. Yeah, so from these pictures, it's difficult to say what stage.
Even when it comes to lumps, can a lot of people tell that they have lumps or might not?
Um, if those patients who examine their breast regularly and they notice something different, yeah, they could be having lumps. Um, in patients with small breasts, it's easier to detect lumps. So patients who realize they have lumps, usually they have a smaller breast. Those with bigger breasts is a bit difficult to notice that they have lumps, especially if they don't examine themselves routinely. Sometimes even when they examine, they can't differentiate breast lumps from normal breast tissue. Yeah, so that is why um, we offer screening programs. So come forward for just screening, ultrasound or mammogram. If there are any abnormalities, it can be detected.
Right. Okay. Got it. Fantastic. Great advice. All right. So, who's at risk of this disease?
Both of us. Okay, being a female itself is a huge risk of developing breast cancer. Then, as we get older, the risk definitely increases, like the graph I showed earlier. Family history plays a role, but as I mentioned, not everyone with family history will definitely get breast cancer, and vice versa. If you have breast cancer, it doesn't mean you need to have family history of breast cancer. So, what family history we're talking about? If you have first degree family members, such as your mother, your sister, your daughter, with breast cancer, your risk definitely increases, especially if they are diagnosed below the age of 50, then your risk of developing cancer increases. So screening should start at an earlier age. And those families with any gene abnormalities such as the BRCA1, BRCA2 gene as well, their risk increases of getting breast cancer. Then we have other factors like the reproductive factors, the age at menarche, the age of menopause. If patients they attain menarche at an earlier age and menopause at a later age, their exposure to estrogen is longer and their risk increases, as opposed to someone who attains menarche at a later age and menopause at a younger age. Yeah, and but this is something beyond our control. These are non-modifiable risk factors. You're born like that, so there's nothing much we can do about it. But what we can do is like with every pregnancy, the risk of breast cancer reduces. So you can have many children to improve
Okay.
or reduce your risk. Then we have the estrogen from exogenous source such as oral contraceptive pills or hormone replacement therapies. They increase the risk as well. And the main thing that we can help ourselves is our lifestyle. You see now, I think many Malaysians have adopted this Western lifestyle, eating habits, and all, and many Malaysians are obese and overweight, and this itself is a risk factor of breast cancer. Alcohol consumption is another risk factor. So these are modifiable. So if we can control and help maintain a healthy lifestyle, we can reduce our risk of developing this disease.
Wow. Okay. What's shocking to me is that you said that as the fact that I'm a woman, I'm already at risk.
Yes,
Right.
that's the biggest risk.
Okay. So there you go. 50% of us are at highest risk of having breast cancer because of the fact that we're a
I
woman.
think I showed in my slide earlier. In Malaysia,
Mhm.
our statistics is 1 in 27 women will develop breast cancer in their lifetime. So yeah,
That's
1 in
yeah,
27.
that's very high. That's like half of my class when I was growing up.
Yeah,
Two of us in our classroom will get breast cancer. So there you go.
yeah,
Okay.
yeah.
Speaking of lifestyle, which is right, which affects breast cancer. What if I like? What about food? If I eat healthily, I mean, I'm not gonna get breast cancer, right?
No, not necessarily. Like I mentioned, I mean, you were born a female, so your risk is already there, right? I'm not sure about your family history and your hormone status, but then if you maintain a healthy lifestyle, your risk definitely will reduce. But that doesn't guarantee that you're not going to get breast cancer because you still have other factors like, I mean, we are all aging, we are females, we are already at risk. Yeah, the risk is definitely there. It's just that we can help reduce the risk by maintaining a healthy lifestyle, but it doesn't mean that you will not get breast cancer. I have so many patients um, with breast cancer who are vegetarians, who are so slim, so fit, they exercise regularly, but yet they get it. And, they ask questions like, I'm like that, I'm like that, I'm like that. And yet, I got this disease. I don't even have a family history. How is this possible? It's so difficult to answer because there's so many other factors involved.
Wow, this is absolutely shocking to me. What about you guys who's tuning in? Momo, Jasmine, Gwen, are these things that are shocking to you guys? What's the most shocking thing? Let us know in the comment section. Jasmine is loving that breastfeeding can reduce the risk of breast cancer. So there's going to be women who's just going to get pregnant just to reduce. Just kidding. Okay. So speaking about misconceptions, food was the biggest misconception for me. I think what other common misconceptions are there out there?
I think the common ones would be the talk about bra. There are a lot of rumors out there that discourages the general public from wearing bras, especially the wired bras, because it is believed that it obstructs lymphatic flow out from the breast, and the build-up of toxins in the breast can lead to breast cancer. But it is not true. There's no scientific evidence to support this statement. And the next thing is the use of deodorants and antiperspirants.
Mhm.
Um, Many believe that the aluminium and the parabens that is part of the content of these deodorants can lead to breast cancer, but it's still being studied. So far, there's no hard evidence as yet. Yeah.
Okay, got it. And I think
Okay. 1 minute, my slide.
okay. Well, I think so that was wearing a bra doesn't kill you. I mean, wearing an underwire bra is not going to get you breast cancer. And using a deodorant as well, there's no study proving the links of wearing a deodorant to breast cancer. Anything else? What else is shocking for you guys? Ida was just about to type it in about the wired bra. In fact, while we're waiting for the slides, what other misconceptions are you guys hearing out there with respect to breast cancer? Let us know in the comment section so that we can sort this out once and for all with Dr. Kiran. Yeah. So, what are the other misconceptions that you are hearing? What about getting a mammogram, Dr. Kiran?
Okay.
I hear,
Well,
yeah.
yeah. Many out there are very fearful to get mammogram done for two reasons. One, they are afraid of the pain because they
Mm-hmm.
said, doktor nanti kempis breast sangat sakit lah. And then they will say, kawan saya cakap, jiran saya cakap buat mammogram sangat sakit. Yeah, of course there will be some discomfort because the breast is compressed, isn't it? For mammogram
Mm-hmm.
part, with our newer machines, it's bearable. It's not painful. I would say it's just there will be some discomfort. Yeah, it's
Okay.
doable. And another
Mm-hmm.
thing is that the radiation associated with mammogram. Some are afraid to get a mammogram done, thinking that the radiation exposure by mammogram can, cause you to have breast cancer. Another misconception out there is that mammogram, when they compress the breast to get the mammogram done, if you have cancer, it will, encourage or, cause it to spread further. So all this is not true. The radiation definitely is there, any form of X-ray, there is radiation, but the radiation is low. The dose of the radiation is low. And when we speak about the benefit as well as the risk, the benefit definitely outweighs the risk of this minimal radiation. So it is definitely beneficial to get mammograms done if your age allows, and yeah, and if you fit into the criteria for the screening programs. Yeah.
Right. So basically, mammograms are unsafe. Too much radiation is another misconception. Yeah. Jasmine is also asking, oh, what about overweight can cause breast cancer? I think that's one of the questions, misconception. Is it really a misconception?
No, no, it's true.
Mm-hmm.
Obesity and being overweight is a known risk factor for breast cancer, especially after menopause. Because after menopause, our estrogen is produced in our fat tissue. Uh, Prior to menopause, our ovaries are functioning well, so estrogen is by the ovaries. After menopause, is by your fat tissue. So
Mm-hmm.
obesity is definitely a risk factor, especially after menopause. So
Okay, got it.
maintaining a healthy weight.
Yeah, so that means being overweight is actually increases your risk of getting breast cancer. So that is not a misconception. Ida is also saying that yes, getting a mammogram is bearable. Takkan sakit terjerit pun. So thank you very much for confirming what
Yeah,
Dr.
that's
Kiran is
true.
saying. Thank you, Ida. So cute. Okay. All right. Now, Dr. Kiran, let's say someone is diagnosed with breast cancer. I think somebody asked this, Momo, I think asked this. If somebody is diagnosed with breast cancer and they don't want mastectomy, are there any other options?
Yes, yes, definitely.
Mm-hmm.
You see, patients when they are diagnosed with breast cancer, the first thing that will hit them, okay, I'm going to lose my breast. But that is not true. Not all patients will, undergo mastectomy, especially those who are diagnosed at an early stage with small tumors. We can perform breast conserving surgeries or lumpectomy, meaning that the lump with surrounding normal tissue is removed and the breast is preserved. So you still get to keep your breast, and but you get your tumor removed. And even those who have to undergo mastectomy, there are options of recreating your new breast, either with external implants or using your own tissue to create new breast. As we can see in this picture, we can use our muscle from the back, the latissimus dorsi, as well as from our tummy, our abdominal muscles, flip it forward, flip it upwards to create a new breast after a mastectomy. So all this is doable, and if you put on your clothes, no one will even know you have done a mastectomy because new breast can be created. Yeah, provided if patients come with
Very.
stage 4 disease. Stage 4 meaning
Mhm.
the cancer has already metastasized to the lung, liver, bones, and things like that. Then, of course, surgery is no longer an option. Then patients are sent for chemotherapy. So you lose the chance of getting good treatment. This is the reason why we always advise patients come for treatment early, because treatment is available. Yeah, many things can be
Wow.
done. Yeah.
So I guess the best solution is definitely to come early, get it detected so that there are more options available for you and that
Yeah.
it's not only mastectomy. And so this is another misconception, that the only what do you call it? The only surgery available is mastectomy, right?
Yeah. Yeah.
Okay. So, okay, another misconception which kind of shocked quite a few people with the data. Have you ever had any male patients with breast cancer in your practice?
Well, when I was attached to University Malaya Medical Center, we had a few male patients with breast cancer, and we tend to see male breast cancers in the older men. Actually, yeah, the risk for male breast cancer also increases with age, and the few which I myself saw, they were above 60. Yeah, and the thing about male breast cancer is that they tend to present at an advanced stage compared to ladies. And why is that so? It's because when they have any abnormality in the breast, first thing first, they won't even think of breast cancer because they are not a woman, right? So,
Oh.
that will not even cross their mind that, oh, it could be breast cancer. So they tend to present late. That's number one. Secondly, even if they have a breast, it's a lot smaller compared to a female breast. So when even a small lump can infiltrate the skin, can infiltrate the underlying muscles, and that increases your stage of disease. So yeah, they tend to present at a more advanced stage compared to ladies. And I've written here, this is our Malaysian data. Over a span of 5 years from 2012 to 2016, we had 291 male breast cancer cases.
And this number is increasing, is it?
Yes, yeah.
Wow. Okay. So there you go. Even if you're male, you could be having breast cancer. Get it checked early. Should it even be called breast cancer for them? I'm just wondering. Should it be chest cancer?
No, no, no. You see, that's another misconception. They
Okay.
do
What is it?
have breasts. They do have breasts. It's just that it's not developed.
I see. Okay.
Yeah,
Got
you
it.
see,
So,
they do
mhm.
have a nipple, they do have the areola, there are ducts behind the nipple, but the breast lobules are not well developed as in females because they don't have estrogen, right? Yeah.
Okay, got it. So men have breast cancer and not chest cancer. Got it. I learned something new today. Okay. Okay, Dr. Kiran, for many patients who are diagnosed with breast cancer, a lot of them are not able to accept it. Maybe because of the media, maybe because of the movies. The next scene you see, they get diagnosed. The next scene, they get a mastectomy. So everybody almost always thinks is the end of the world, is the end of life as we know it. So what is your advice for patients who are newly diagnosed with breast cancer? I think this was a question Momo asked as well. So for patients diagnosed with breast cancer, whether they're men or women, what's your advice for them?
My advice would be, of course, when you are informed that you have breast cancer, it's shocking. It's definitely shocking, and not every patient can accept it immediately. Some, they'll be in shock. Whatever you speak after that, nothing goes in because they cannot accept it's
Hmm.
difficult to digest.
Blank out, space out,
Yes,
right?
exactly. So this is when family support is very important. Family support
Hmm.
is important, and patients should have a clear mind. Accept. The earlier you accept, the earlier you get yourself treated, and the better the outcome. Some patients, they cannot accept. They are in denial. They tend to seek traditional, healers' help, and then they come back to us at a later stage where options are limited. So always remember, you are not alone, right? You have your family with you, you have your doctor with you. If you cannot cope, we have many support groups with, breast cancer survivors. They have many support groups that can assist you and, lift up your spirits. So this journey is definitely difficult to be, to go through alone. You need good support from your friends, your family, your doctor, and those close to you. But don't give up because treatment is available. Outcome can be good if you undergo proper treatment. Yeah. So there's always light at the end of the tunnel. Don't give up
Okay.
hope. There is always hope. Yeah.
Okay, so not all breast cancer is a death sentence. There's always hope. There's a lot of support as well. So don't think it's the end of the world. Most important thing is to get support. Dr. Kiran, out of curiosity, what's the main difference between the patients who are able to accept the news and the ones who are in denial? Is there any difference between them, or to I guess I'm asking to help people come to terms with the news faster, kind of thing.
You see, yes, of course, there is a difference. You see, we have
Mhm,
two groups of patients.
mhm,
One is okay, they tend to accept it easily, and
uh-huh,
okay, so when can I get my surgery done? They're
mhm,
already prepared for the next step. So this group of patients, they are more positive, and they know there is hope if they get themselves treated, and they tend to do well with good outcomes because everything is done as soon as possible. And
mhm.
then we have another group of patients which are in denial, nak balik rumah dulu, nak bincang dengan family dulu. And then jiran datang, saudara kata, jangan chemo, cuba ubat ni dulu, cuba itu dulu, like, so then there's delay in treatment and outcome is definitely affected. So
Wow. Okay.
the earlier you get diagnosed with prompt treatment, outcome is good. If
Okay. Got it.
patients present at an advanced stage, then options are limited. Definitely options are limited.
Wow. It sounds like it's a lot to do with the mindset of, yeah, I've got a life after this. It's just a disease. I can handle this. And opposed to another one, the mindset where it's, I don't know, I'm not sure. That I might not have hope if I accept this news. Is that it, kind of?
Yes. And
Wow.
we have patients as well who refuse to get breast surgery done because they are afraid that their spouse will leave. Yeah, so we have patients going through that as well. So then they will keep the tumor. Mm.
Wow. Okay. So in cases like that, what do you suggest? Is it because they're not speaking to their spouse?
We do have,
Uh-huh.
I mean, we try to arrange family conference, meaning that
Mm-hmm.
when we break bad news to patients, we always advise them to bring someone along, someone close to them, their family members especially. If they
Mm-hmm.
are married, their spouse; if they are not married, their parents or siblings, because it's difficult to, to be alone first to accept bad news,
Mm.
and second thing, you need to sort of decide what is next, so you can't be doing everything alone. So when we explain, we try to include the spouses, but yes, they are there listening, but when they go home, they have a different mindset. So
Mm. Yep, you're
no,
right.
not
I
not
think.
not not all patients are, like that. We have many very supportive husbands who want their wives to get treated immediately, but we do have a small group who refuse as well. So yeah,
Okay. So I think moral of the story is like what Jasmine is saying here, optimism and pessimism. It's not enough that the patient has to remain optimistic and have a positive outlook on life. I think the family should also have an optimistic and positive outlook on life. And all this is possible if we get ourselves equipped with knowledge and awareness about this disease. And I think Momo is also saying that for her mom got the news that she had breast cancer, but the mom's always saying, I'm happy, tak apalah, semua takdir di tangan Tuhan. And then walaupun kadang-kadang suruh menangis kau-kau. That's what Momo. Thank you for sharing with us
yeah.
your version of the story, Momo. Continuing along, what are the most common mistakes that people make when it comes to breast cancer in your experience, doctor?
I won't say mistakes, but how we can improve the
Okay.
situation. I think that will be a um, um, we encourage the general public to come for screening programs, even
Mm-hmm.
if they feel that their breast is normal, there's no symptoms, there's no lumps, nothing. If you are at a certain age suitable for screening, please come forward for screening programs. It's available in, I think, almost every hospital in the country, even in the government or private, likewise. And if there is any abnormality, any symptoms, anything that you think is not right or not normal, something new that you've noticed on your breast, don't wait. Come early. Come early for assessment, for evaluation. Even if it turns out to be
Nothing.
normal, yeah, it's
Mm-hmm.
fine. Yeah.
Better
That
safe than
would be
sorry,
my,
right?
yeah, advice to the public.
Okay, got
And
it. Uh,
and another thing will be to stop spreading false news.
got
Yeah,
it.
all these misconceptions that oh, you tak payah chemo lah mesti mati, tak mati daripada cancer, chemo yang akan bagi mati. So many things that, yeah, out there people discuss, which is not true. So yeah,
Okay.
consult the healthcare professionals in any doubt.
Okay, got it. So basically, stop spreading all this misconception and myth. Basically, after this, go and share this video out. Okay. In fact, we got something for you later. Okay. Stop spreading false news. Okay. Lastly, Dr. Kiran, what are some tips that you can share with people who's diagnosed with breast cancer or to their caregivers?
Um, I would say that it's not easy to go through this journey alone. So family plays a very important role. I mean, if you are in that situation, you would want your family and your close friends to be with you. It's not easy. When we break bad news to our patients, their whole dream, everything just crushes, in front of their eyes, their dreams of seeing their children, getting married or to see their grandchildren, so many things. Or those who are not married, they're already planning their marriage. So everything just, changes overnight. But like I mentioned earlier, there's always, light at the end of the tunnel. Family members should be there with the patient to go through this journey. Don't allow them to go through this alone. If those family members or patients themselves who can't cope, please reach out because there are support groups available to assist. Yeah.
Wow. Okay, cool. And Jasmine is right. Jasmine thinks that even teenagers should learn from breast cancer. What is BSE? Breast self-examination
Yes, yeah,
since
best
young
self
age. Okay, I
esteem.
got that right. Yeah, not Bangsa Shopping Center. Okay, okay, got it. All right. Thank you so much for that, everyone. If you would like to type in your question so that Dr. Kiran can answer for you, let us know in the comment section. In the meantime, what is your biggest takeaway from today's session so far? What's your biggest learning? For me, number one, if you can detect it early, that can actually have an impact in your life, life expectancy within 5 years by 95%, right, Dr. Karen? That to me was really profound, especially if you're able to detect it at stage one and stage two at an early stage. And then secondly, the fact that I'm a woman, I'm at risk from having breast cancer. That's my biggest takeaway. And as well as for men, they too can get breast cancer and not chest cancer. I guess that's my biggest learning. But what about you guys? What's your biggest learning from today? And yes, there's a lot of false information and misconception and myths surrounding breast cancer. So if you can share this to create awareness to a lot of people, that would really help reduce the rate of breast cancer. Kind of thing. For Ida, she's saying do screening, go. Um, right. Okay. So let's go into some Q&A. I'm going to go right to the top where I think there's a question from, hang on, yeah. Okay, there is a question from Momo. Momo is asking, doktor, saya nak tanya breast cancer. Okay, this is the penyakit turunan, but we already answered that. It's one of the myths. It's only 5 to 10%, correct? Mm. Okay, so let's look at, so Momo, I hope that answers your question. Let's look at Jasmine Liu's question. Dr. Kiran, when is the best time to do BSE or breast self-examination every month? And since we're asking this question, when should we start actually?
The moment you have a breast, you can start breast self-examination. So even teenagers should be taught how to examine their breast. Okay, when is the best time every month to examine your breast? I would
Mhm.
advise immediately after you complete your menses. Because prior to menses, many women have tender breasts and some swelling, very difficult to examine for lumps because there's already some degree of swelling and tenderness. So once your menses, your last day of menses, you can examine your breast. So first, examine by standing facing a mirror without your top. Look for any changes, abnormalities, and then lie down and palpate your breast. Feel for any lumps or any abnormalities. Make it a
Okay.
habit to examine every month.
Mhm. You also mentioned that you guys, if there is no symptoms, to also come in and have a check. When should we start doing that?
Okay, for I mean the general public, we advise 50 and above.
Mm-hmm.
Mammogram once every 2 years. That is our Malaysian guidelines.
Mm-hmm.
But below the age of 50, you can always come for clinical examination by your healthcare professional. And if there's a need, we can get an ultrasound or mammogram done. but it will not be done routinely as per the guideline says, above 50 once every 2 years. If there is strong family history of breast cancer, meaning that if there are many first degree family members with cancer, then screening definitely we start earlier, either at age 30 years old or 10 years before the age your family member was diagnosed. Yeah.
Got it. Okay, speaking of mammogram, SP Yan is asking, Doc, what is the reason that female age under 40 is not advisable to take mammogram?
Two reasons. One is because when we are younger, our breast is more dense. When breast is dense, mammogram is not the best modality to pick up abnormal lesions. When we grow older, especially 50 years and above, there's more fat tissue which has replaced your breast tissue. And fatty breast, it's very easy to pick up any abnormal lesions on mammogram. So you see, mammogram is like an X-ray view, right, of the breast. Any abnormalities appears opaque or white. A dense breast also appears white on mammogram. So white on white you cannot pick up.
I
Whereas in
see.
a fatty breast you don't see white on your breast. It's dark gray. So any white spots can be picked up very easily. That is the first thing. Second thing is studies have shown that mammogram above the age of 50 has shown to significantly reduce mortality due to breast cancer. And below the age of 50, the mortality is the reduction in mortality is not so significant. So therefore, that's why they came up with the guidelines 50 and above mammogram. But we do perform mammograms 40 and above, but it's not routine screening every 2 yearly. Only if there's any abnormalities and things like that. Below 40, the best modality is still ultrasound because
Mm-hmm.
ultrasound works better for dense breast compared to mammogram. For
I
patients
see.
with very high risk family history of cancer, we start screening early. Mammogram is difficult to detect abnormalities in dense breast, so then we can offer MRI as well for
I
this group.
see. Okay.
Yeah.
There's a really brilliant question from Momo here. She's asking, what about males? And males also can get breast cancer. Do they do mammogram or there's something else for them?
Ultrasound and mammogram.
Oh, ultrasound. Got, got,
Ultrasound and mammogram. Both.
wow. Okay. I thought it works for bigger breasts as opposed to small
No, no,
breasts
no,
and with
no,
men.
no. Even
Okay.
small
Also
breast.
can.
Yeah. Can.
Okay. Got it. Okay. There you go. Men, get your mammogram done kind of thing. All right.
But
Shall
we
we
don't
go?
have routine screening mammograms for men.
Yes. I guess
we
not. We
don't
don't.
we don't do it
Yeah.
every 2 years, 3 years. No. Yeah.
Okay. So Ida is asking, so for below 50s, is it better to do health screening with cancer tumor marking?
Okay, I think what she meant was tumor markers, the blood test to test for tumor markers. The
Mm,
tumor marker for breast cancer, the CA15.3, is not, we don't use it to diagnose breast cancer actually. It is not screening method, so I don't think it's going to make much difference.
mhm.
Still mammogram and ultrasound.
Still mammogram and ultrasound, yeah? Okay.
If
All
if
right.
the tumor marker was sensitive and specific to pick up breast cancers, then it will be part of our Malaysian screening program, right? But it's not
Mm,
anywhere in the world too. Yeah, so
I
it's not.
see. Okay. Okay, got it. All right. So going back to a couple of questions from Momo, what is the first step that we need to do once we figure out we have breast cancer?
What is the first step?
Yeah.
Okay, I think the wise step would be to sit with your doctor and discuss what is next because
Mm,
the treatment for breast cancer is tailor made. So I mean, if we diagnose 4 or 5 patients with breast cancer, the treatment is not going to be the same for every patient. So it's difficult to say what is going to be your first step. But you will have to sit and discuss with your doctor what is the next step. But on imaging, if on ultrasound and mammogram we detect any suspicious lumps, the first step is to biopsy the lump to confirm the diagnosis. Once we have the biopsy results confirming that you have breast cancer, only then we will sit and discuss, okay, now what are your options?
Okay, got it. So the first thing is sit down with your doctor to see what options you have because each breast cancer is different. Yeah. Speaking of breast cancer, Momo is asking, ada yang Gina, ada yang ganas. How do we distinguish between them?
Ada yang Gina, ada yang ganas.
Yeah. I
Okay.
love how she puts it. So nice. Right?
No, she's right actually.
Yeah,
Because
yeah.
we have cancers, slow growing tumors. We have aggressive tumors as
Uh-huh.
well.
Uh-huh.
Yeah. How do we determine? You see,
Mm.
I can have two patients with 3 centimeter lump in their breast. One
Mm-hmm.
patient probably had the lump only for 2 months. The other patient could be having that same lump for 2 years. So yeah, that
Wow.
shows that the 2 years one is slow growing, but the one that came with 2 months history could be a more aggressive tumor. How do we know? It's based on the tumor biology. When we
Mm-hmm.
s- when we send the tumor to the lab, we get
Mm-hmm.
various findings
Report.
in the histopathology report, right?
Mm-hmm.
Uh, yeah, that we from that information we can get a rough idea whether it's aggressive or not. Also based on
I
the
see.
hormone receptor status of the tumor, whether it's estrogen positive tumor or estrogen negative, as well as HER2 positive or negative. Those which are negative are usually the more aggressive tumors.
I see. Okay. Wow. I did not know. Um, so basically, it also impacts your life expectancy depending on whether you have a ganas one or a Gina one, right?
Yes.
Yeah. Momo, brilliant question. One more question from Momo. Her mom is a breast cancer survivor. Adakah breast cancer akan datang lagi selepas dinyatakan sembuh?
Bukan akan datang, tapi boleh datang. You see,
Thank you for the correction as well. I love Momo. I love how you're answering to this as well.
the risk of recurrence is definitely there. And
Mm,
the risk is highest in the first 2 to 5 years. After 5 years, the risk of recurrence
it's lower.
decreases. But
Mm-hmm.
having said that, it can still come back. I'm not
Mm,
sure if any of you watched my talk 2 weeks back. I had a breast cancer survivor with us sharing her experience.
mhm.
She she was diagnosed with breast cancer at a tender age of 22, and when she was told, everything is fine, and completed her 5 years of everything follow up, everything was good. At that point, she had a relapse.
Oh,
Yeah,
okay.
so yes, even though you complete your treatment, the risk of recurrence is definitely there, and therefore, breast cancer survivors need lifelong follow up. The first 2 years, 5 years, we see patients more regularly, but 5 years onwards, we don't see them as frequent, but we still see them regularly. Yeah.
Wow. Okay. Great. Fantastic question. Just one more before we go to the quiz. Jasmine is asking the time frame to, I'm not sure what the right word is, decimate the Gina and Ganas. Okay, Doc, you got to figure out this question because I'm not quite sure what it is. This could be a
Saya tak
typo.
faham.
Time
Saya tak
frame?
faham.
Is there a time
Time
frame
frame
to between
determine. Oh, time frame to
determine?
determine the Gina and
Nowadays, we
Ghana.
got to learn autocorrect.
There is no time frame.
I see. Okay.
Yeah, very very difficult to determine. Yeah,
Okay, got it. So it really depends. But once you have the biopsy, you can kind of tell
yeah.
how
You can
aggressive is
you
this.
can have a rough idea. Yeah.
Okay, got it. Okay, cool. So now let's go into the quiz. All right. How many of you guys are ready to win some goodies. All right. Okay. First things first, as mentioned earlier, in the earlier part of the show, we've got 3 foldable travel bags up for grabs. But first, what do you guys need to do to win? First, you have to share this video out to at least 3 times. And remember to set the share post to public so that everybody can see it. Next, answer the 3 questions that we're going to be asking shortly in a single comment, and you are on the way to win prizes. Let me repeat that. Okay, so are you guys ready? Okay, first share this video out 3 times and remember to set the post out to public so everybody can see. Secondly, answer the 3 questions that we're going to show on the screen in a single comment, and we will select the first 3 winners based on speed, the correct answers, and your shared post. Okay, are you guys ready? All right. So first things first, let's have a look at the question. All right. 1 in 27 women in Malaysia will develop breast cancer in their lifetime. Is it true or false? 1 in 27 women in Malaysia will develop breast cancer in their lifetime. True or false? Question number 2. Wearing a wired bra can lead to breast cancer. True or false? And the third question is, a mastectomy is the only type of surgery offered to breast cancer patients. True or false? Question number 2, wearing a white bra can lead to breast cancer. True or false? A mastectomy is the only type of surgery offered to breast cancer patients. True or false? So let us know in the comment section in a single line whether it's true, false, false. Make sure you share the post 3 times. Okay, and make sure it's set to public. All right. Wow. So the answers are coming in while we're getting it checked. In the meanwhile, I'm going to continue with the Q&A with Doc. Doc, are you ready? Ida, I believe, is asking. Let me just check. Hang on, yeah. Later, we missed the question. Okay, so Ida is asking, Doc, as a general public, being a friend to a breast cancer patient, what is the right thing to say to them? Okay, definitely, she got stopped spreading false info. But is there any? How can we be with our friends? You know, as when we hear of the news that they've got cancer, what's the best way to support them?
Actually, it's a very tough question to answer because
Mhm.
when you are dealing with cancer patients, right? First thing is you have to be very careful with what you say because it's very sensitive. Second thing is some, not some, I would say many, right? They don't want to hear anything from you. They just want you to be around. You see,
Mm,
many will say, be strong, stay strong. But in the patient's mind and heart, right, it's easy for you to say, be strong, stay strong. But I'm going through it, you are not going through it, you wouldn't know. So, it's very difficult to choose the right words and what is correct to say to the patients. But I believe many patients just want their family and friends to be with them, not say things, give ideas. Another thing is some friends who will come over selling their products. Take this supplement, this supplement, this supplement. It will help you. So it just confuses the patient further.
Okay, so I think that's such an amazing answer. Thank you so much. You are right. I think for a lot of people, and especially they say stay strong. If the patient doesn't want to stay strong, so what? Let them deal with it, right? It's okay to have feelings, right? Whoever told you to stay strong? That's the most ridiculous thing, right? And you're right. The most important thing is to be there, and sometimes we don't even need to say anything, but to just be there for our loved ones and our friends. And I think that's the one that matters most. They just need some comfort in you being there. So thank you so much, Doc. That's such a brilliant answer. There's another question from Momo. Momo, I'm loving you today. So many questions from you. Last one for the day. Adakah air susu ibu yang mengeras dan menjadi batu di dalam breast boleh menjadi breast cancer? Okay, I don't know if this is a we can add this to your future slides of misconception and myth. What do you say, Dr. Kiran? Thank you, Momo. Love you.
What Momo is actually asking is bengkak susu. Bengkak
Oh.
susu can cause infection and inflammation, but no, not cancer. It's a totally different problem.
I see. Okay, got nothing, tidak berkenaan dengan breast cancer. Yang
Ah,
yang ganas atau yang yang
Gina.
mild? Yeah, yang Gina. Thank you, Momo. Thank you so much. Okay, and Ida is saying, okay, then a hug in silent. Yes, brilliant. Love you, Ida. Thank you so much. I'm learning so much from today. I think we've got the winner. Do we have the winner? Yes, we do. All right, but before we announce the winner, let's take a look at the correct answer, shall we? So, question number one. 1 in 27 women in Malaysia will develop breast cancer in their lifetime. Doc, true or false?
True.
Okay, it is true 1 in 27 women will develop breast cancer in their lifetime. Wearing a wide bra can lead to breast cancer. True or false, Doc?
False.
Okay. Wide bra does not lead to breast cancer. A mastectomy is the only type of surgery offered to breast cancer patients. True or false, Doc?
False.
False. There's a lot of options available, especially if you come for early detection, kind of thing. Yeah. So those are the right answers. Thank you so much, Doc. And the winner goes to number one, Jasmine Liu, Ida Nazri, and Momo Bubu. You know what? I just have this to say. For the ones who are very engaging, who are asking all the questions, you guys are the winners. Congratulations. So
Congrats.
congratulations. Yeah, congratulations, Jasmine Liu, Aida Nazri, Momo, Boo Boo. Well done. Okay. Don't just hang in there, everyone. What's going to happen is we're going to be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. All right, so you can get your prizes. Congratulations once again to Jasmine Liu, Ida, and Momo. All right, Doc, thank you so much for today. I've definitely learned a lot, and so have all our viewers here. Jasmine, Bobo, they're all thanking you, and Yoki as well, saying thank you, Doc, for such an informative session. Hopefully, we can move forward and stop. And basically become your myth busters of these misconception and myths about breast cancer. Okay, got it? All right. So be sure to share the video. Thank you so much. Yeah.
Thank you for
So
having me over, Nina. Thanks for
yeah.
hosting the show, and thank you everyone for joining us this evening. Hope you have a lovely day.
Thank you. Now, guys, if you know someone who's going to appreciate today's tips and insights from Dr. Kiran, please share this video out, tag them, because you never know who is going to make a difference to. And give us a lot of like and lots of love while you are at it. Thank you again. Till then, I think that's all we have for today. Let's also give a big round of applause to Dr. Kiran, shall we?
Thank you.
Woo. All right. So thank you so much, everybody. Till then, take care of yourself and each other. And we will see you in the next episode. Be sure to share this video out. I'm Nina signing off. Today has been Doctors Go Live. Thank you and bye.